There's a healthcare crisis happening in America right now.
I just got my hospital bill for a total of a whopping $41,288.
It's actually so insane to me how broken the US healthcare system is.
Imagine going to the hospital and not a single nurse is there. Well, in New York City, 15,000 nurses walked off the job this week, making it one of the largest nursing strikes in US history.
So who's supposed to take care of the patients during a strike? No one.
Now imagine waking up sick, scared, or in pain. And before you even see a doctor, you already know the bill might ruin you. Imagine doing everything you were told to do, getting insurance, paying every month, following every rule, and still being sent home with no answers and a bill bigger than your rent. Imagine hospitals full, nurses gone, insurance companies deciding who gets treated and who waits, and families quietly realizing they cannot afford to be human anymore. This is not a future story. This is happening right now. And if you think this doesn't affect you, that's the most dangerous part, because it already does. Stay with this story till the end, because what you're about to hear isn't just frustration, it's a warning. And if you want more deep, real conversations like this that break down what's really happening around us, make sure you subscribe, because this is a conversation we can't afford to stop.
There's a healthcare crisis happening in America right now. People are going to be paying way more for their monthly premiums in 2026. I've been seeing increases from 100 to 400%. Even people on Medicare who live off their Social Security checks, they have to pay 10% more on their Part B, and they're getting way less benefits.
Millions of Americans just woke up in 2026 with a fucked up surprise. Their health insurance just increased drastically in price. Overnight, the enhanced ACA subsidies expired, and Congress did nothing to stop it. Nothing. But I don't think anyone is surprised. These tax credits kept premiums affordable for over 20 million people. Self-employed workers, farmers, small business owners, parents, people who don't get insurance from a job and don't qualify for Medicaid or Medicare. Some families are seeing costs double. Others are seeing them triple. One mom's premium went from $85 a month to nearly $750. Another went from $350 to $500 just to stay covered.
$800. 2 medications. If we did not have health insurance, the flu and strep throat, 2 ladies in our family have this, it would have cost us $800 without insurance. Somebody fix our health care. Somebody, please.
So in the past month, just to make sure that I'm not dying, my doctor's visits have cost me $3,286. But don't worry, guys. Don't worry, because my insurance covered $6 of it. $6 of it. My insurance that I pay hundreds of dollars for hundreds of dollars every month covered $6. America!
There is a healthcare crisis happening in America right now, and it is no longer something you only hear about on the news. It is showing up in people's mailboxes, in their email inboxes, and in their bank accounts. People are opening hospital bills and seeing numbers that do not make sense. $40,000 for a few days in a hospital. $15,000 for a long wait in an emergency room and a few basic tests. $600 out of pocket just to be told nothing is wrong and sent home. This is happening to people with insurance, people who pay every month, people who followed every rule they were told to follow. And yet, when they actually need care, the system feels cold, confusing, and punishing. Families are waking up in 2026 to find their health insurance premiums have doubled or even tripled overnight. Someone who was paying $85 a month is suddenly paying $750. Someone else goes from $350 to $500 just to stay covered. These are not luxury plans. These are basic plans people rely on so they do not lose everything if they get sick. The enhanced ACA subsidies expired, and Congress did nothing to stop it. Millions of people were protected by those tax credits. Self-employed workers, farmers, small business owners, parents, people who do not get insurance through a job. When those credits disappeared, the cost shock hit instantly. There was no warning, No soft landing, just higher bills and fewer options. Even people on Medicare are feeling it. Part B costs are going up, benefits are shrinking, and seniors who live on fixed Social Security checks are being asked to pay more while getting less. For people already choosing between groceries, rent, and medication, that extra 10% matters. It is not an inconvenience. It is a threat to survival.
So how much does it cost to go to the emergency room in the greatest country in the world? Especially for someone who has pretty good insurance and has already met their deductible for the year. Should be smooth sailing, right? Well, let's consult the bill. Now for context, I went to the emergency room because I was feeling extremely bad and they told me that nothing was wrong. But just to clarify, I got zero help. They did run blood work and they did do an echocardiogram, but there was nothing wrong with me and I was perfectly fine. Spoiler, I was not perfectly fine. So back to the bill. If I didn't have insurance, that little trip would have cost me $6,159.88. But like I said, you have pretty good insurance and you've already met your deductible for the year. So you probably barely paid anything, right? Nope. Somehow, your total is still $542.36 to be sent home. And if you thought that was it, you would be wrong because you also have to pay the doctor. Yes, that's right. Nowadays, you get two bills, one bill to pay the hospital and another bill to pay the doctor because God forbid they all work together. In your second bill, you learn that you also owe the doctor before insurance, $1,286, after insurance, $51.41. In total, you are on the hook for I'm trying to do this math in my head, $593.77. Nearly $600 to be given no help and sent away. And this is with your good fancy insurance. God forbid you have anything worse or are uninsured. Greatest country in the world, my ass.
I just got my hospital bill. I was in there for 3 days for a leg surgery, and I'm going to read you the itemized charge list. First, semi-private room and bed changes, $12,487. Changes for drugs and IV solutions, $2,222. Medical surgical supplies, $2,918. Clinical laboratory changes, $5,314. Operating room charges, $7,749. Anesthesia services, $2,157. Physical therapy, $874. I literally had no physical therapy. I had surgery and I walked with a nurse when I got out. And I was the one who said I wanted to walk on my own. I literally held some random nurse's arm. Emergency room services, $5,615. Recovery room services, $1,948. For a total of a whopping $41,288.
Then there are the actual medical visits. People go to the emergency room scared, in pain, doing what they are told is the responsible thing. They wait for hours, 5 hours, 6 hours, sometimes longer. They get blood work, a scan, maybe an x-ray. They are told nothing serious is wrong, or they are told to take Tylenol and go home. Days or weeks later, the bill arrives. $10,000, $15,000, sometimes more. Insurance might cover most of it, but most of it still leaves people owing thousands of dollars. $2,000 out of pocket is not small money. $600 is not nothing. And this is for care that felt rushed, dismissive, or incomplete. People are also discovering that having insurance does not mean having access. Someone gets injured, cannot walk, is in pain, and needs an MRI. They have a referral. They follow the process. And still, insurance denies it. They are told to do 6 weeks of directed care first, even when they are clearly injured. The choice becomes pay thousands of dollars out of pocket or live with the injury and hope it gets better. This is not medical care. This is paperwork deciding someone's health. Doctors and nurses are frustrated too. Surgeries are delayed not because there is no operating room, but because insurance companies decide where doctors are allowed to operate. An operating room can be ready, staff can be available, a patient can be waiting, And still, the surgery does not happen because of network rules. The care exists, the system blocks it. At the same time, the people who keep hospitals alive are breaking. Nurses are exhausted, burned out, and traumatized. 1 in 4 plans to leave bedside care within 2 years. Not because they do not care, but because caring under these conditions is destroying them. Unsafe staffing ratios mean nurses are responsible for too many patients at once. Research shows patient death rates rise when nurse-to-patient ratios get worse. Yet hospitals keep pushing nurses to do more with less. Executives earn millions while nurses struggle, often working second jobs just to survive.
You want to say that again?
No, I'm not going to repeat myself. But you are discharged from the hospital.
I would like to see in my medical form where you treated me for this issue.
I've explained to you what I'm I'm going to step away. Nope,
required by law. You are supposed to show me where in my medical chart.
Medical records if you'd like to, and they can send whatever results.
No, I want to see it right now.
That's not an option. I can't do that.
I want to see it right now. Where
from the hospital.
Where in my medical forms is how you treated me for the hole in the back of my throat?
Here's patient relations.
I already called patient relations. They did nothing for me.
Okay. So at this point, you're discharged from the hospital. I'm not going to continue while you're recording.
I am so tired of things in healthcare just not making any common sense. Today they canceled a bunch of cases again because of a facility issue. Like, they didn't have safe operating rooms to operate in. So my breast cancer cases had to be delayed like 3 hours. I had to move one to another facility for tomorrow. I have an operating room that I could take these cases to, but because insurance gets to say where we get to operate, I can't. Like, I have an operating room sitting there ready, and I have women who need care, but because the insurance company, in this case it was United, hasn't allowed me to be in network at my surgery center, I can't do the cases there. So today the patient just didn't get surgery when she could have gotten surgery if they would just let me. It just doesn't make sense.
In New York City, 15,000 nurses walked off the job, one of the largest nursing strikes in U.S. history. The core issues are safety, staffing, benefits, and basic respect. Hospitals say they have offered enough. Nurses say it is still unsafe.
Thousands of nurses have walked off the job across major New York City hospitals, triggering one of the biggest healthcare strikes in recent years. The strike began after marathon negotiations through the weekend collapsed without a deal. Hospitals hit include New York Presbyterian, Montefiore, and Mount Sinai. The nurses' union says nearly 15,000 nurses are participating, demanding safer staffing levels, better workplace security, and limits on the use of artificial intelligence in hospitals. Hospital management, however, says the union's demands are simply too expensive.
And when nurses strike, people ask who will take care of the patients. The hard truth is, that is the point. Without nurses, hospitals cannot function. Units close. Patients are sent elsewhere. The system feels the pressure only when the money stops flowing. Travel nurses are sometimes brought in and paid huge amounts to cross picket lines, but they walk into the same unsafe conditions that caused the strike in the first place. And when something goes wrong, it is not the hospital that pays the price. It is the nurse. This is why nurses are saying, not all money is good money. Many nurses are leaving not just their jobs, but the profession entirely. 40% leave within the first year, 60% by the second. Years of education, massive student loans, and emotional trauma push them out. Then hospitals claim there is a nursing shortage, when the real shortage is nurses willing to accept unsafe, toxic conditions. All of this is happening while the country faces one of the worst flu seasons in years. Millions are sick. Tens of thousands are hospitalized. Hospitals are already understaffed and overwhelmed. Fewer people are getting flu shots. A severe outbreak on top of a broken system creates real danger. When people avoid care because of cost, illnesses spread and worsen. When hospitals cannot staff safely, outcomes suffer. Patients feel it. Healthcare workers feel it. Everyone feels it. People are starting to skip doctor visits because they are afraid of the bill. They delay treatment until things get worse. They feel dismissed when they do go. Nurses feel gaslit, blamed for systemic failures, pressured to work unpaid time, and punished for overtime caused by impossible workloads. The emotional toll is heavy. Anxiety, depression, PTSD are common among bedside staff. What emerges from all these voices is the same feeling: exhaustion, fear, anger, confusion. A sense that the system no longer makes sense and no longer feels human. Healthcare is supposed to be a place of safety when things go wrong. Right now, for many Americans, it feels like another risk, another gamble, another bill waiting to happen. This is not about one bad hospital or one bad insurance company. It is about a system where costs keep rising, care keeps shrinking, and the people inside it are burning out. Patients are afraid of getting sick. Nurses are afraid of going to work. And everyone is wondering what happens next when something truly serious happens and the system cannot hold. That is the reality playing out right now, quietly, painfully, in homes, hospitals, and lives across the country.
40% of new nurses leave nursing, not just a job, nursing within the first year, after spending years and how much money to become a nurse and get that degree, up to 60% by the second year. It's outrageous. And then they claim there's a nursing shortage. No, it's a shortage of nurses willing to work in the toxic conditions. There's a lot of parallels between an abusive relationship between, say, two partners and being a nurse. It's like, I have to stay for the kids. I have to stay for the patients. They will absolutely scrutinize if you have any fractional overtime. So you clock out 15 minutes later than the end of your shift. Why? Because you have too many patients and it's impossible to get the work done, but they don't want to acknowledge that. They will start micromanaging and every single day call you in the office. You had 8 minutes of fractional overtime. If this doesn't improve, you're going to have progressive discipline. And so nurses will clock out when they need to clock out and stay and work for free off the clock, which is illegal. They gaslight the hell out of them and say, if you had appropriate time management skills, you would be able to clock out on time. Maybe you need to come in early. So they're coming in early. They're not allowed to clock in when they get there. They're accessing medical records, which is actually a HIPAA violation. But the manager has been encouraging that. We're working for free. We're putting ourselves in jeopardy, but we're so beaten down into submission and always told it's our fault.
The Department of Education recently made one of the dumbest decisions ever regarding healthcare. They decided that nurses, nurse practitioners, physician assistants, occupational therapists, and physical therapists, among others, are no longer considered professional degrees. Not only is this extremely insulting to some of the most integral healthcare providers that we have, but it will also likely impact staffing of these types of practitioners. We're currently facing an extreme nursing shortage, and it's only going to get worse over the next several years. Now, there are a lot of reasons for this, but one big one is burnout. Surveys show that 4 in 5 nurses face extreme stress while at work. And this has only been made worse after the pandemic, where you get stupid people who don't respect them and will even assault nurses. And staffing shortages, partly caused by poor reimbursements from insurance companies to hospitals, cause these nurses to have to handle many more patients than they can safely handle. Now, on top of that, the Department of Education, headed by former WWE executive Linda McMahon, is now calling them no longer professionals. And this will limit the amount of federal student loans that nursing students can take out. Now, this can't make the nursing shortage worse, could it? Now, the fact is that nurses are the most important part of the hospital system. Yes, even more important than physicians. If all the nurses were to quit their job today, the hospital system and healthcare would fall apart literally within minutes. But if you think about it, if all the doctors would quit today, then nurses can actually keep this shit going for a while. And then you take physical therapists, all of them whom now are required to get a doctorate in physical therapy to practice. They too will be limited in the federal student loans that they can take, so that they literally will not be able to actually pay for schooling.
The aggressive new flu strain, being called the super flu, that's never a good sign, has hit New York with a surge in new cases. The latest data from New York State shows close to 190,000 cases this season, with health officials logging 71,000 new cases, the highest number ever recorded in a single week. Now, this season, the Centers for Disease Control estimates that more than 4.6 million Americans have had the flu, with over 49,000 hospitalizations and 1,900 deaths. It is worth mentioning that according to the CDC, there has been a decline in the number of Americans getting the flu shot, down 3 million from last season.
When you step back and look at all of this, it no longer feels like separate stories. It feels like one broken system hurting everyone inside it. Patients are paying more and getting less. Nurses are burning out and walking away. Care is delayed, denied, or rushed, while fear and bills keep piling up. Healthcare is supposed to be where you feel safe when something goes wrong. But for many people now, it feels like another risk they cannot afford. And that should worry all of us. Because sooner or later, everyone needs help. When that moment comes, you want a system that works, not one that makes you choose between your health and your survival. If this made you think, stay here, subscribe, and keep watching, because these are the stories that affect us all, and they are becoming impossible to ignore.